COVID numbers, are they accurate? Part 2. If you didn't see my first video, Part 1, COVID numbers, are they accurate? Please go watch that. I'm just going to give you a quick review of what I covered. Before we do that, I want to talk about the most important thing that we should all be talking about is increasing the strength of our individual immune systems, improving the health of the host, and that's doing those 5 things that are absolutely in our own control. Number 1 is improving our nutrition. Number 2, getting regular exercise. Number 3, reducing our chronic stress. Number 4, taking care of our spine and our nervous system. And number 5, getting enough sleep. On the first video, COVID numbers, are they accurate? Of course they're not, and there's a lot of indication that that's the case. Remember that I talked about hospital administrators now admitting that they are reclassifying non-COVID deaths at COVID deaths, and I had to figure out why, and sure enough it was because they were getting stimulus money from HHS. The more demonstration of COVID stress on the hospitals, the more reimbursement they were getting. And there are individual reports of reclassification of death certificates to COVID, and then of course other admission of that. And I think it was one of those things of the law of unintended consequences. Secondly, we talked about the labs in Florida that were inflating results. I talked about in June where on WBR, Massachusetts was now counting those who expressed symptoms that were suspected cases but not confirmed. That would have elevated the numbers. I also talked about a very, very important method of correcting those numbers, and that would be anonymous reporting by hospital administrators of the people that they classified as COVID deaths that weren't confirmed and reclassified from other causes of death, and having those reports being completely anonymous, not pointing fingers, nobody's guilty of anything, just let's get the accurate numbers. Now, why the beef? Why am I talking about this? Why am I doing a second show on this? It's because we are dictating public policy, very important public policy on these numbers. And if the numbers go up, we do certain things. We don't allow businesses to open. We don't allow kids back in school. We don't allow activities to occur. Very serious business, serious decisions go on these numbers. So if these numbers are inaccurate, then we're not making accurate decisions. And we're all involved with this. That's why I'm spending the time on this and thinking that the numbers should be accurate. Well, here's the part 2. WHDH.com, among others, reported a Massachusetts lab, Massachusetts in the United States, a private lab in Massachusetts reported more than 100 false positive COVID-19 tests. They had 460 tests that they pulled out. They sent them to an independent lab. Sure enough, 130 of them were false positives. The very specific scenario in here is two cities in Massachusetts. Taunton was taken from a high level to a moderate level of COVID-19 cases. Fall River was taken from moderate to low with that new information of the false positives. So it reduced their intensity level, if you will. So once again, public policy is being made with these numbers, and we just have one little lab with 130 cases that were false positive, shifting what towns and cities are going to be doing. That's why it's important. The National Football League reported some false positives as well that were taken back. You probably all heard about that. USA Today on August 25th reported in Manchester, Vermont, there were false positives that were then deemed negative. The Ohio governor, Mike DeWine, had a positive test before he greeted the president. They were confirmed later to be negative. That would change his scenario there. In Maine, there were a bunch of campers that were reported positive and then deemed negative after that. Here was a really interesting piece I just heard on the NPR show Here and Now, August 26th of 2020. The NPR reporters, some of the international correspondents, Eleanor Beardsley in Paris, Rob Schmitz in Berlin. And by the way, when Rob Schmitz did his piece on what's going on in Berlin, he had given very specific things what's going on with the education system. The priority in Germany is to keep kids in school. Now, they are doing monitoring and lots of testing, and they have backup plans, and they have quarantine plans, and so on and so forth. But their incentive here is to keep kids in school. We should learn something in that, and that's a big country with tens of millions of people. Now, Frank Langfitt did a report from London, and I wanted to really point out this. So listen to this one here. Now, he reported that the positive cases are up, just like the other folks reported in the other European countries. But he said that the thing that jumps out to me is the low number of deaths. And he said, now this is a country of 66 million people in the UK. But there were just 4 deaths yesterday, the day before August 26th, when this report was done. And he said, the infections are shifting away from nursing homes, and we know that coronavirus ripped through nursing homes everywhere in the planet and long-term care facilities, but it's shifting to younger people. And he said he's very heartened to see the numbers improving, the low numbers of deaths, and so am I. And again, I think of this as we're seeing these infectious numbers maybe go up, but that doesn't mean that the deaths are going up. So that's important, and that sounds like flu. That sounds like seasonal flu. And remember that I talked about that the CDC stopped counting seasonal flu deaths after early April in 2020. We shouldn't do that. You shouldn't all of a sudden, if this is what they're doing, is start reclassifying seasonal flu deaths as coronavirus deaths. No, because that's, again, inflating the numbers and changing public policy. And then that just adds to fear, and fear adds to chronic stress, and chronic stress adds to our decrease in immune system response. Therefore, we're going to have more severe disease. So that just brings me back to this thing. We could split hairs all day long with these numbers, and it comes down to this. Over 99% of people, probably more like 99.9% of people that get exposed to coronavirus will live. Very similar to, not quite, but very similar to seasonal flu. So therefore, we should spend the majority of our media time and our focus and our attention, we as individuals and families, communities, school systems, countries, towns, whatever, we should spend our time on strengthening our immune systems. And that is done, again, by a super clean diet. By the way, go look at Dr. John McDougall's information on improving your diet, which improves your immune response, which decreases the severity of infection. Number 2 is get that regular exercise. Number 3 is reducing that chronic stress. Number 4 is taking care of your spine and your immune system. And number 5, getting adequate sleep. That is going to be our best moves going forward. Thanks for joining me. I'm Dr. Scott Fuller.